Miss Smith, how are you?
Okay, how are you?
I'm well. My name is Bree. I'm a physician assistant student. I'm going to be seeing you today.
Okay.
What brings you into the office?
I've been having a headache for the past week and a half.
Week and a half.
Mm-hmm.
Did it come on suddenly?
Yes.
It did. Okay.
Mhm.
Can you explain the headache for me a little bit?
It's like adult pressure. It kind of like starts in the forehead, kind of goes behind my eyes and to my left ear.
Okay. Behind your eyes and to your left ear.
Yeah.
Huh. Were there any points where it was a sharp pain, or has it always been a dull pain?
Adult pressure.
Okay, okay. So does the pain that goes behind your ear, does it go anywhere else in your head?
No.
Does your neck get stiff at all? Okay. So do you also have any runny nose?
I have some congestion. It's not as bad as it was before.
Okay.
But there's and a cough.
And a cough?
Yeah.
Okay.
And a fever.
You've had a fever?
I had that kind of first.
Okay.
And then the headache kind of came on.
Okay. Did you take your temperature, or were you just?
The highest it was 101.1.
Oh, okay. And have you taken anything to try and help?
I've taken Tylenol, but that hasn't even touched it.
Really?
Mm-hmm.
Okay. It hasn't even touched the pain or the fever?
The pain.
The pain.
Yeah. The
Okay.
fever I can deal with.
Yeah.
But
The fever it looks like it's come down a little bit. Now, you said the fever came on first. Okay. The fever came on, and then the congestion and coughing?
Fever, congestion, that was all kind of the same time. The
Okay.
headache came like a couple of days after.
Okay, okay. Have you ever had pain like this before?
Never.
Never.
Mm-hmm.
On a scale of 1 to 10, how bad would you say is this headache? An 8 out of 10.
Mhm.
Okay. Have you had any change in your vision? No. Okay. Have you had any ringing in your ears?
I had popping, that kind of just happened a couple days ago.
Popping.
Yeah.
Okay.
Um,
Any sore throat?
Did have a sore throat, that's one.
Okay. Okay. Now you had a cough. Have you had any shortness of breath?
No, sure.
Okay. And you said you're coughing. Have you been coughing anything up?
Greenish, yellowish.
Greenish, yellowish junk. Okay.
Mhm.
Okay. Have you had any chest pain?
No.
Okay. Any nausea, vomiting? Okay. Okay. All right. Okay. So tell me a little bit about your past medical history. What should I know about you? Have you had any heart issues?
No.
Okay. Have you had any lung issues?
No.
Okay. Have you ever had any issues with your thyroid?
Perfect health. Perfect health.
Perfect health. Okay. Any past surgical history?
No.
Okay. Okay. Have you ever been diagnosed with allergies?
I have seasonal allergies.
You do have seasonal
But
allergies.
this doesn't seem anything like that.
Okay. Okay. Okay, so no surgeries. Does anyone in your family get headaches like this?
Nothing like this, no.
No. Okay. Can you talk to me about your parents? Are they still alive?
My father's deceased, he died of a heart attack,
Okay.
and my mom's still alive, good health.
Okay. No cancer in the family?
No.
Okay. Do you smoke?
Unfortunately, yes.
How much?
Every day.
Okay. For how many years?
And
Okay. And do you drink?
sexually,
Socially, how often is that?
once in a blue moon,
Once in a blue moon?
not very often.
Once a month, once a,
How about it once every couple months?
okay. And how many do you have when you do?
One or two.
Okay. And any drug use,
No.
marijuana, ecstasy,
Mm-mm.
over-the-counter drugs? No?
No.
Okay. How about, do you live with anyone or by yourself?
No, I'm my husband, my son.
Okay. Either of them sick?
No.
Okay. So now I'm gonna ask you questions head to toe, just to make sure that I'm not missing anything. So you said you had a fever. Have you had, a decrease in appetite?
No.
Okay. Change in weight?
No.
Okay. Okay. Have you felt like you've had any heart palpitations?
No.
Okay. Okay. Do you feel like you've had a decrease in strength? No? You haven't felt like weak or just blah? Okay. Have you had any change in your bowel habits? Bladder? No? No pain urinating?
No.
Okay. 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 All right. Well, let me do a quick exam on you. I have the information from the medical assistant as far as your temperature. You're at 99.8, so you're a little warm, but you're not what we typically call a fever. Okay. So the first thing I'm gonna do is just take a look at your eyes. I want you to look straight forward. Okay. Now that the lights are back on, because I turned the lights off, I'm just gonna touch your head and you let me know if anywhere I touch you hurts. Right pain there, there's pain there. In there, in there, okay. How about back here?
No.
And anything under here? I'm not feeling any nodules. Okay. That's a good thing. I'm gonna have you open up your mouth. So with your tongue. Open up your nose. Excellent. Arrange your mouth. Where are my glasses? These are clean, these are my extra ones. Okay. Ears. Okay. Should I be noting
Nope,
anything?
there's nothing there to say.
Okay. Okay, very good. Okay. Next I'm gonna, listen to your heart and lungs.
Okay.
Okay. I'm gonna have you take a big deep breath in and out through your mouth. Next I'm actually gonna have, you lay down on the table. Yeah. Okay. I'm just gonna palpate your stomach, and you let me know if there's anything that hurts.
Okay.
I'm just gonna lift up your. No. Sit right up.
Oh, okay.
Next thing I actually want you to do is, I'm gonna just check your extraocular muscles, just because you said that you are having the pain behind your eyes, I just wanna make sure that those are working as well.
Okay.
Okay, so you're gonna, look at my finger and just follow it, okay? see my fingers, just let me know, okay?
Same. Same.
Excellent. Okay. Okay. It sounds like what's going on here, can I tell you what I think's going on? It sounds like what's going on here is that you're having a lot of congestion in your sinuses, which is causing you the pain here and here, and a lot of the congestion. And it sounds like that there's a infection that's going on in your sinuses itself. So what we're gonna do is we're gonna try and get rid of that congestion, get rid of the bacteria that's causing the congestion, and send you on your way. Because you are a smoker, it makes it more likely that it's actually a bacterial infection that we need to be treating instead of a viral infection that's going on. So we're going to be treating you with an antibiotic, and giving you a nasal decongestant to take home as well, just to kind of get some of that out. The stuff that you're coughing up, I'm thinking is actually postnasal drip.
Okay.
So it's from your nose. It's not from your lungs because your lungs sound clear. So all the gross stuff that you're coughing up has to do with that. Do you have any questions for me?
No.
Okay. You're doing well? Okay. Okay, good. Well, I'm going to put you on some antibiotics, probably somewhere around a week, and it'll be a high-dose medication. And if you have any issues, you call us back. It's going to take a little while for the congestion to come down, but your fever should go away relatively quickly with the antibiotics. You might still have a little nasal drip even after the antibiotics are done. I need you to finish the whole course, all right, and use that nasal spray. Try and wash your hands. Don't give anybody else any.
Oh, no,
any
don't
germs.
do that.
Okay. Well, so nice to meet
Nice
you.
to meet you.
Thank you
All
so
right,
much.
good.